show that all the young Turks who are attending, we have a first division on 6th, 7th, and 8th of December 2024. Registration is till 31st of August. The postgraduate students have a special, registration fee. The call for abstract, the last date of submission is 30th of September. You have lots and lots of awards to be won, both for presentation as poster presentation, and we also have debates. So please make use of this opportunity and register yourself ASAP, as well as send your research work. Interesting case histories. So after 30th of September, what I've decided is that we will accept some abstracts, but not for competition. So if you want the abstracts to be considered for competition, so please submit them on time. Sir, all yours.
Yeah, thank you so much. So now we hand over to the next program. Dr. Ankita is already there. Hello, Ankita.
Yeah. So
Hello,
we
sir.
are
Good
we
evening,
are
sir.
gonna start the Journal Club mentoring session now. Dr. Ankita, your talk has been awaited by, I think, so many messages we got that we want to know about this ASHRAE certification for clinician. Ankita is a brilliant doctor. She is DM in reproductive medicine from AIMS, and there are uh, uh, many awards to her credit. So today she will be guiding us how to go for ASHRAE certification for clinicians. What are the minimum requirements? This is the vision and passion of our president as well as our secretary, Dr. Shweta Mittal. So Ankita, stage is all yours. Please start.
Thank you so much, ma'am. Ma'am, may I share my screen if
Yes,
that's
yes, please. Yes,
Yeah,
please.
sure.
okay? Uh, Ma'am, is my screen visible?
Yes, it is.
Yes.
Okay. The first, I would like to thank Shweta ma'am and Pankaj sir for this opportunity. And as I spoke to Nisha ma'am also about this, so it's a wonderful initiative from IFS sir and ma'am, because frankly speaking, I didn't get any guidance because nobody was aware much about this certification. Coincidentally, one of my friend had just mentioned it, and she told me that you are maybe one of the people who might be eligible for this, so just go for it. So after that, I thought about it. So as ma'am has already mentioned about Fertivision and the call for abstracts, so guys, please send abstracts for Fertivision. So I'm a consultant in reproductive medicine, gynecology,
I
and
think,
IVF.
Ankita, let me introduce you.
Ma'am, it's okay.
Yeah, no, let me have that privilege to
No,
introduce.
no, ma'am, please.
Ankita is a consultant in reproductive medicine and gynecology and working in Fortis Rich Fertility and IVF Center, Shalimar Bagh. So when I was reading her, CV, it was very impressive. Gold medalist of MBBS from MAMC, a gold medalist and her MD from AIMS. And she's done DM reproductive medicine from AIMS and now has earned one, I think, medal to her so many qualifications and getting the European Fellowship of Reproductive Medicine. We are very proud of you, Ankita. And now the stage is all yours to present and guide those people, because I remember I am from the first batch of Fellowship of National Board, and I was totally lost because when I came in the first, nobody even knew what books had to be read in reproductive medicine. And very slowly, I said, okay, everybody used to learn Burn Hall. Then one day I went to a conference and one, stall person told me that, no, ma'am, you should buy Gardner. There is a book called Adashi. And this is how I started slowly building up my books and my reading, and all the observers who would come to me doing different trainings, I would always learn from them. So Ankita, there's always a start, and that is why we wanted this to happen. And you will be like a guiding person if somebody is willing and wishing to do the European Fellowship certification. So Ankita, all yours.
Thank you so much, ma'am, and thank you for the opportunity. And I would love to guide everyone, and as much as I can, I will help them. So, basically, this what we were calling as ESHRE certification for clinicians is basically called a European Fellowship in Reproductive Medicine, or EFRM exam. It is certified by both ESHRE and EBCOG, which is European Board of Obs and Gynae. So both of them have come together to give the certification. So their objective mainly is that ESHRE starts its examination process in reproductive medicine in close collaboration with EBCOG to set a standard of knowledge in reproductive medicine. So people who are successful in the exam can use the title of EFRM, ESHRE, EBCOG. So basically, this exam has two parts. One is part one, which is a knowledge-based assessment process. Part two is an objective clinical examination. So only candidates who have passed part one can give part two. I think majority of the people who have given MRCOG will have an understanding of what is part one like and what is part three like. So it is similar to that, especially MRCOG part two and part one of this EFRM exam are similar in terms of, I'll be going into details also, that is single best answers are there, or there are multiple extended multiple questions are there, which is similar to MRCOG part 2. Then the MRCOG part 3 is sort of similar to this part 2, which is an objective clinical examination where we have different stations basically for a viva. So I'll be going into the details subsequently. So these are two parts. Part 1 can be given and as an online exam from your home also. But their criteria are very, very stringent, and the online security is very, very stringent. So normally on the ESHRE website, you get these kind of details that are available, that when is part 1 and when is part 2. Right now, they have not given any dates for 2025 exam. This is only a yearly exam. Every year they conduct it. For 2025, the dates are still awaited. So I've just mentioned it that this is available on the ESHRE website. So what they do is they start the applications for the part 1 exam. They have some criteria. I'll be discussing that. And then they open the application and they give a time frame, that is from the 1st February 2024 to 30th April 2024. Then the exam is an online exam, which was on 8 June 2024. The results come out within a week or 10 days. And after that, you are eligible to give, if you're passed exam, you can give it the part 2 in the same year, which is near to the annual conference. The conference was on 7 July. So this time the exam was held on 6 July 2024. And then you get the results again by the end of 1 week or 10 days. So I want to emphasize one thing right now over here is that if you apply for part 1 exam, one is the application period is adequate enough. There's no problem. You can easily apply, they'll reply and everything. It's a good amount of 2-3 months time that is there. The only problem arises because of the timeline that they do is what I gave part 1 in 2023. I'll tell you why. And I couldn't give part 2. Because in the same year, even though I passed part 1 in the same year, I couldn't give part 2 in the same year because, as you can see the timeline, the exam was on 8 June. We got the result by 20th June. The exam was supposed to be on 6 July. You cannot get visa in 10 days or 15 days time. It's very difficult to arrange the entire trip like that. So from their side, you can give part 1, part 2 in the same year, but people giving from India, it might be difficult to get the visa and prepare for the entire trip within 2 weeks' time. So when I got the result, it was difficult to get the visa and the logistics. So I actually, when I went for the part 2 exam this year, that is on 6 July 2024, I mentioned this problem to them and they said that they will look into it and they will try to do the part 1 exam earlier so that there is at least 1 or 2 months gap between part 1 and part 2 results, and so that the other people can give part 2 in the same year and they don't have to wait for 1 year. So maybe that is the reason in 2025, there might be a change in the timeline. So this is the exam fee. Again, it's mentioned on the website that for part one, it is 450 euros for the ESHRE members and 550 euros for the non-ESHRE members. And similarly for part two, it is 500 euros. And non-members, it is 600 euros. And this includes only the examination part, nothing else, no conference, no traveling, everything you have to arrange. So coming to the eligibility criteria, which is very important. One is that we should be at least 2 years of subspecialty training should be there. They have a pretty stringent criteria. Again, I'll be discussing about that. But what I want to emphasize everyone is that I'll be discussing about details. I'll be giving some PDFs also, which is available on the HTA website, which mentions about the clinical training module, what are the expectation, what is the minimum number of cases required for each and every procedure. They have noted it down. It's a huge 28-page logbook. So people who are doing reproductive medicine subspecialty right now, they're in training, or the ones who have already done and they are interested. The most important thing right now is to have a logbook for those 2 years, which should satisfy the ESHRE cutoffs. So if you have that thing authenticated and validated, and when you share with them, they make you eligible for the exam. So touchwood, I had my logbook. I had basically 3 years of logbook with me. And then I converted it into the ESHRE logbook, and I got through the eligibility criteria. The second important thing is you should have MRCOG or either EBCOG, that is the European Board of Obs and Gynae. Majority of people in India these days are giving MRCOG. EBCOG is not that common. So I had done my MRCOG and I had 3 years of training in reproductive medicine from AIMS through my DM. So that's the reason I was eligible, because of these two criteria. So they have mentioned a lot of stringent criteria, like the training center should be ESHRE certified. But in India, no training center is ESHRE certified per se. But when I'm going through the clinical logbook and all, you'll be able to understand they have mentioned that whichever center you are working in or the training center that you're working in, they have given some criteria for that as well. That the place where you have done your training should have this many number of cases per year. So they need proof of that as well. Then coming to, again, research activity is required. So suppose it's a 2-year course or a 3-year course. If you have done a thesis, you have either presented it somewhere, especially in ESHRE annual meeting, or you have published it as a first author, then they find that eligible. So again, they in their logbook and in their criteria, they have mentioned how many number of publications are required, and at least one publication as a first author is required. And the good standing certificate is required for the medical regulatory body. So the certificates that are generally submitted, like what I submitted was a MBBS certificate, then the MD certificate and my DM certificate, along with the good standing certificate, my DMC, and all my logbooks. So this is, as I said, I can share the log. It's available on the HTA website in a PDF form, but I can share it on the WhatsApp group as well. So this is just a screenshot of that logbook cover itself, which they have also given. So people who are already, right now, they're doing their training, they can ask their senior consultants whether you are permissible to fill up this HTA logbook in this format or not. Or late, the ones who have already completed, then they can go back and fill up this logbook and get it signed from their senior consultants. So this is the logbook that is available on the website. So they have mentioned the content of training program, what is the definition, what is the aim, what are the objectives of the ESHRE certified training, what is the organization of the training. So you can go through the PDF nicely. And what the main concern is that the training center where you have done the training, whether that is fitting the bill of the ESHRE certification or not. I have highlighted this, as you can see. Fulfillment of defined criteria for minimum activity in your training center. That is 1,000 outpatient infertile couples a year, 100 ovulation inductions per trainee, 100 insemination per trainee, 100 reproductive surgery per trainee. 300 ultrasounds per trainee, and 200 IVF cycles per trainee per year. So these are the little stringent criteria. Then the minimum duration, the 2 years of duration of training, all these topics need to be covered: andrology, counseling, psychology, endocrinology, genetics, reproductive biology, reproductive surgery, and ultrasound imaging. So I've just put a screenshot of this. These are part of the logbooks, basically, which I'm talking about. It's a 28-page logbook given by the ESHRE on their website. And these are just snippets of them that you can fill right now, the ones who are doing it, and the ones who have already done it. Then they have to go back and get this thing filled and countersigned by your concerned senior consultants. So it includes everything from integrated knowledge to your sense of duty, punctuality, technical skills, organizational skills, research, ethics, everything. So this is what we're talking about. Again, in the logbook, they have mentioned cumulative list of scientific meetings and courses attended by the trainee. Cumulative list of papers presented at scientific meetings. A minimum of one as a first author is required. So they have not mentioned whether it should be PubMed indexed or anything like that, but obviously I think that would be their preference. So they have not mentioned anywhere that it should be PubMed index or Google Scholar index or anything like that. Again, cumulative list of peer-reviewed published papers in international journals. Again, that should be at least one as first author. Similarly, national journals also. So they have one page for everything. So you have to fill it according to your number of cases that you have, number of publications that you have done. So I've finished the eligibility criteria about the logbooks and all, and a bit about what exactly is part 1 and part 2. So again, people who have already given MRCOG, they might have an idea. The ones who have not given MRCOG yet, they might need to give MRCOG to be qualified for this exam, other than the reproductive medicine training. So as I said, the part 1 exam is an online exam, can be given from home, but they have a stringent security criteria. They send a proper, basically give an email. There's a proper, app software that you need to download, register yourself in it. And after that, you can give the exam. So those kind of things, the people have given MRCOG part 3 and part 2 from home also in the COVID period. So basically in the room, there should be nobody else in the room. There's no other face can be visible. Everything should be like properly visible, only then you can give the exam, otherwise cheating is considered. So those kind of criteria are there. So proper software is there that they will mail you. So then you can give the part 1 exam. Again, part 1 exam has 2 parts. A part is 2-hour paper, the other is a 2-hour paper. So there's gap of some minutes in between. So the first paper contains physiology and diagnostic procedure. The second one contains mainly the IVF, the treatment and the methods that are there. And there are different type of questions. One is a multiple choice question, then the single best answer question, and the extended matching questions. So again, extended matching questions, the ones who don't know about it, it's basically they give a clinical scenario and then they give 10 options. So out of 10 options, you select the best possible answer. Again, the passing percentage is not 50%. It depends on the difficulty level of the exam. And then they calculate, they have formulas to calculate how to go about it. So passing percentage varies every year. Again, similarly to part 2 exam of MRCOG, where everyone is aware about that the passing percentage can range from 60% to 70%, depending on the difficulty level of the exam and who all are giving the exam. So this is part 1 exam. You get the results again on the email in 1 week to 10 days time. And once you get that, then they send the link for part 2 exam and how to register for the part 2 exam. So part 2 exam is a OSCE exam, objective structured clinical examination, very similar to MRCOG part 3 exam. So, but it has to be given, you have to go there and give the exam. So it is every year, wherever ESHRE is taking place, they will take the exam there. So what I am aware about is ESHRE next year is in Paris. So in 2025, if you're giving a part 1 exam and if you have enough time in between and you are sure that you're going to pass part 1 exam, you can prepare for applying for visa for part 2 exam. you will have to go to the place wherever ESHRE conference is taking place. Like this year, it happened in Amsterdam. So I had to go to Amsterdam to give my Part 2 exam. It happens one day prior to the main conference. So conference runs from 7th July. So it took place on 6th July. So now coming to what happens in the Part 2 exam. Normally in MRCOG Part 3, you have 14 stations. But here there were less number of stations. So basically, I'll tell the practical thing. There were 12 candidates. 6 people took the exam in the morning and 6 people took the exam in the evening. We had, I think, around 6 or 7 stations. In each station, one senior consultant, pretty senior consultant from ESHRE committee was there to take a viva. Presently, there are no role plays. There is no patient there, but they are planning to inculcate that in the subsequent exams, which I have heard. But in this exam, there was no role play as such. They had given clinical scenarios. That clinical scenario was also just 2-3 line clinical scenario, like in recurrent implantation failure. They had just written 2-3 lines about it. Rest, you have to take out the history and the examination and the investigation findings from the examiner. And after that, and everything has to be done within 10 minutes. Very important thing, because it's OSCE 10 minutes. So history, examination, investigations, and then you tell about the management and whatever questions the examiner needs to ask about it. So this time it was on recurrent implantation failure, recurrent pregnancy loss, fertility preservation. It was mainly an adolescent female with a ovarian mass, borderline ovarian tumor, and then how will you do fertility preservation? So again, it was not a direct question. It was a clinical scenario, and I had to take out history and then go to the diagnosis. And then she asked about fertility preservation. So it was not direct. But again, everything has to be done within 10 minutes time. Then there was one embryology station also, where they showed reports of semen analysis, oocyte pictures, how to grade those oocyte pictures, embryo pictures, how to grade those embryo pictures, which embryo you will select for embryo transfer, whether you will transfer 1 embryo or 2 embryo. All those questions were there in the viva. And she's a chief embryologist, a pretty senior embryologist was taking the viva at that time. And one more station had reproductive endocrinology, which had secondary amenorrhea and management. And one station was on research methodology statistics. So they had shown an abstract from fertility sterility and asked about what are the pros and cons of this abstract. What do you understand from the abstract? How can you change, basically, how can you increase the authenticity? So it was what I got was a retrospective. Even the sample size was very big, but it was a retrospective study. So I told them that you have to have an RCT to have a better evidence. So those kind of things. And then it was like, it's a retrospective study. So how can you improve the evidence? So you have to conduct a RCT based on the same thing. So those kind of things. So research methodology, statistics, these are also very important. So I'm getting some messages in the chat box. So I'll be discussing about the syllabus also. I'm telling you the practical things which nobody told me. So I thought I'll share the practical experience that I had when I gave the exam. So the number of attempts that you can give, basically, again, as I said, when you give the Part 1 exam and you clear the Part 1 exam, you're supposed to give the Part 2 exam within 3 years of giving the Part 1 exam. If you're not able to go and give the exam within 3 years, then you will have to repeat the Part 1 exam. So this is what they have mentioned on their website. So as I've already discussed, the pass mark is not 50% or there's no particular cutoff. They have a particular formula by which they calculate the passing percentage. I think when I gave the exam, it was around 70 to 73%. But I think this time their exam was easy in 2024, the Part 1 exam. So it was, the passing percentage was slightly higher. So it changes every year. Again, for Part 2 exam, they have a stringent criteria where they do it like either pass, fail, or a borderline. So cumulatively, you're supposed to pass in all the stations. So that will be a cumulative result. Again, similar to MRCOG Part 3. So now coming to, other than your logbook that I have mentioned about, which will be shared on the PDF. Again, they have 4 basic modules. This is also a separate thing which you need to finish during your residency, or people have to go back and get this filled again, where they have given a proper requirement from ESHRE that at least 100 cases you should have seen or managed of gynae endocrinology, and these are the criteria that are there. So these are the basic modules, at least 4 basic modules are there. One is gynae endocrinology, then comes the diagnosis of infertility, targeted therapy, and infertility disorders. What I want to emphasize is that they have mentioned is ovarian stimulation, induction of ovulation 100, IUI 50, again, egg collection 75, embryo transfer 75. So these things you need to finish and get it signed by a supervisor or senior consultant. Similarly, counseling and treatment management in menopause is for 10 cases minimum is required. Contraception, again, these are the cutoffs that are required that you need to fill. Then surgical management of infertility, hysteroscopy and laparoscopy, 150 is required. Then the optional modules are andrology, like semen analysis, semen preparations, how many cases you have done. So out of the optional ones, any 2 you can select. But I think majority of people doing reproductive medicine in India, they're covering these modules as such also. So adolescent gynecology, psychosomatic and counseling training. So how many hours, how many cases have you counseled? Gynae endocrinology, how many cases? So all of them, these are, as I said, required cases, and how many you have completed, and you have to get countersigned by your supervisor. As you can see, name of the supervisor, sign and stamp, and everything is required. So why I'm emphasizing on these things is because these are the most important. Syllabus is fine, I'll be discussing that. But people who are already reading reproductive medicine right now, the syllabus you will cover. Don't worry about that. The important thing is the logbook and the training and those stringent criteria that you need to fulfill for the eligibility criteria. So from the syllabus point of view, again, there's a PDF. I can share that. I've taken screenshots from there only. That includes general reproductive endocrinology that we have already read in Spiroff or general Gardner's and everything. So basic physiology, reproductive endocrinology, pediatric and adolescent gynecology, everything related to infertility A to Z that we are doing as a reproductive medicine specialist that you have read in Gardner's or Kamini Rao in any book. So everything needs to be covered A to Z. From the laboratory aspect also, as I told you, in the exam also, you get a lot of questions from embryology and andrology. And even in my part 2 OSCE also, there was quite a number of embryology and andrology questions that I had to answer. And yeah, in RIF, they ask about PGT and everything also was discussed. So you have to be thorough about that. Andrology, reproductive surgery is important in terms of endometriosis and endometriotic surgeries and stuff. Why I'm saying, because again, at the end of the day, everybody asks, what did you read for the exam? So obviously the ones who are undergoing training right now or who have finished the training, you have already read Gardner's or either Kamini Rao or all the guidelines related to ASRM and ESHRE. So whatever notes you have, you can go through your notes or you can revise whatever study you have done. So there is no fixed thing. If day to day you have practiced and you've given your exams and all, so more or less things are covered. Whatever time I had, I emphasized on ESHRE guidelines mainly. So I went through, I just like went through all the ESHRE guidelines that I had read during my DM, and whatever new guidelines had come up in 2023 and 2024, I went through them. Because obviously in ESHRE exam, they will emphasize on their own guidelines. So similar to MRCOG, when we are reading for MRCOG, you go through their guidelines thoroughly. Similarly, giving ESHRE exam, go through their guidelines thoroughly because they emphasize on that. As I said, for example, in the embryology part, they were asking whether you will transfer 1 embryo or 2 embryo. So if you go through the ESHRE guidelines on the number of embryos to transfer, they have emphasized on transferring single embryo irrespective of a lot of stuff. So they wanted to hear that in the exam, and they were really asking that question. So they also include early pregnancy, implantation, recurrent pregnancy loss. And although, again, the guidelines are there on recurrent pregnancy loss, right? Fertility preservation, again, guidelines are there on fertility preservation, ESHRE as well. As I mentioned, basic principles of research. So there was a particular station in my out of 6 stations, one station was only on research methodology and statistics, and how do you conduct studies and how you can improve on them. So this part needs to be strong. So then coming to when I was talking to Dr. Nisha ma'am, was like, why did you give the exam? What is the importance of giving the exam? Again, it doesn't add that much this thing to our day-to-day practice, but taking India to a global platform, basically on the ESHRE website, all the AFRM certified fellows, the names are there. So they started this from 2019 onwards, and every year they have been conducting except the COVID period. So when I was preparing for the exam, I genuinely went through all the fellow names and whatever. If I thought if somebody was an Indian, I tried contacting them to find out what exactly happens in the exam. So there are two people who had given two Indians who have passed the exam prior to this. One is Dr. Avni Pillai from Kerala in 2022, and one is Dr. Rana Mondal from Kolkata. So I did try contacting them, got few tips from them, and this year, surprisingly for me, because I didn't know so many people are giving the exam. There were 12 people who came for part 2 exam. Out of them, 4 were Indians. One is me, one is Dr. Hema. We are settled in India. 2 more were Indians, but they were settled in UK. They've been practicing obs and gynae and reproductive medicine in UK for quite some time now. So I mentioned their names. So just to encourage everyone, out of 12, 4 were Indians. All 4 were passed. And out of 12, only 9 had passed. So
Dr.
that's a
Nikita, can I ask you, can I request you to please take the questions? There are a few questions they are asking. I'm sorry, I'm cutting because of the limitation of the time. I'm just requesting you to please take the questions.
sure, ma'am. Sure, ma'am. I'll take the questions.
So the first question is, can we apply with Indian PG in OBS and Gynae and MD DNB?
As I said, obviously MD and DNB is required, but you need to have an MRCOG or a EBCOG. Without MRCOG and EBCOG, you're not eligible to give the exam.
Yeah, so having a MRCOG is the most important thing. Then they are asking, what is the difference between stations in MRCOG Part 3 and EFRM Part 2?
So the difference is MRCOG Part 3 includes all obs and gynae thing. In EFRM, it's mainly reproductive medicine. And as I mentioned, that it is covering stations like recurrent pregnancy losses, recurrent implantation failure, embryology, research methodology, fertility preservation. So these were the topics on the station. And as I said, in MRCOG Part 3, role play is there. A patient is there and you take a history. As of now, in the last couple of years and this year, they did not have any role player. There was no patient I had to take any history. Mainly the examiner was there and I had to ask questions to the examiner directly. It was a case-based structure format.
Okay. And you already mentioned that you had to extract the history. They were not even giving you the complete
Yeah,
history.
yes, ma'am.
They
They were
wanted to
not.
know that what relevant questions you would be asking.
Absolutely.
Yeah.
Absolutely.
So then there is another question. Devanshi asked that I had a publication in JOGI Index Journal that I did during my PG in 2017. Will this publication be considered?
If it's done, it's on reproductive medicine and done during your reproductive medicine training. Because they are concerned about whether you have done any publication in reproductive medicine during your reproductive medicine training,
It
during
has to
your
be
2
related.
years of subspecialty training.
Mm-hmm. Ankita, one relevant question now. Are you eligible to practice in UK as an IVF specialist after this?
Ma'am, not really. They have mentioned on the website that it is a certification, but it is not a license exam. It is
Okay.
just a certification. There is no licensing. So people who are, what I am aware, as I mentioned, Dr. Kanksha Sood and Dr. Joseph Trezier, I don't know them personally like that, but they are already practicing in UK as an obs and gynae specialist. And I think they have to undergo a subspecialty training of IVF over there. EFRM does not certify them. There's no license. It's just a certification. So definitely adds to your CV, but that does not give you a license as far as I know.
Okay.
One
So again,
question
for
on license.
licensing, you will have to do something else.
Ma'am,
Yeah.
licensing, as I said, ki MRCOG, once you have done, you can go and practice there, but they have a subspecialty training separately for 2 years. So they are not for getting a license to work as an IVF specialist. I don't think EFRM is replacing that thing.
Okay.
The other people who are doing it is just an add-on certification, because obviously ESHRE is giving you that certification. So you have that stature. It just
Mhm.
adds to your CV.
Mhm.
Good, Ankita. Extensive overview of the subject. One basic question by Gayatri. Can we apply with Indian PG in option gynae DNB?
Ma'am,
That she already,
yeah, I mentioned that.
it-
No, ma'am, it's
she
like
did
obviously
that,
MD and DNB is required, but you need MRCOG or EBCOG. Without that, you cannot give the exam.
Amrutha, if we have 1 year of fellowship, are we eligible?
Uh, Ma'am, I'm not very sure. If like suppose I've just given example, if 1 year fellowship has been done, plus 2 years of if you have a work experience, but if you can note it down on a logbook, and if they find it authentic, then maybe they will allow. I'm not very sure.
Rajita Pankaj, what books or study material to refer to?
As I said, ma'am, if you have done a reproductive medicine training, so everybody reads Gardner, Speroff, Kamini Rao, all those books. So any book you can refer to. Main thing is, if you're thorough with those books, then you should focus mainly on ESHRE guidelines. Go through those ESHRE guidelines nicely.
Okay. Devanshi Mishra, after MSCOG, do we have to get registered also in UK specialist register, or just passing the exam is enough?
If you have the MRCOG degree after passing the Part 3 exam, that is enough. You don't need GMC registration to give this exam.
So, Dr. Ankita, did you go back to your aims to have this logbook, signed again?
Ma'am,
Because
luckily, okay, yeah.
Indian logbooks are not like this.
Ma'am, luckily, when I came to know about this exam, I was just finishing my DM. I had not, like, it was almost the last week of my DM. So I already had my logbook from AIMS. So I just converted that logbook, like that data, into this ESHRE logbook data and got it signed from my consultant. I was just, otherwise, I think you will have to go back and get it signed.
What we have
Yeah, Ankita, I'm sure there are many more questions. They are all, full of inquiries about this. So I think you can put your mail ID so that if there is any other question, people can message you or mail you and you can answer. Or in the Young Turk group, just to inform all of you that Ankita is a very brilliant member of our Young Turk group. So if you guys have any questions, you can drop it in the Young Turks group and she
Yeah,
will
she will
be
have.
happy to answer those.
Sure,
One
ma'am.
more
Right,
question.
Ankita?
Is the ASHRAE logbook available on the website?
Yes,
By
ma'am, it is available. There is a PDF of the syllabus also available. I took the screenshots from them. There is a PDF of the clinical logbook also available. And there is a PDF of all the modules that are compulsory. All the PDFs are available. You just have to go and type ESHRE AFRM website. You will get it.
Okay, I think we'll wind up, Dr. Neeru.
Yeah. So thank you, Ankita. It was a
Thank you,
nice
ma'am.
overview of the subjects. So all Young Turk, dear Young Turk, keep on joining in large number. We are having various mentoring session like how to qualify MRCOG. Next mentoring session will be for embryologist, ASHRAE certification for embryology, various quiz session. So
And
come
IFS
join.
also runs a very nice online ESHRE, course, which will be happening in November for the embryologist.
Yeah, evidence-based medicine. So all please keep on joining and understand all these things. So Ankita, can you show the next slide?
Yes, ma'am.
Yeah. So now I request everyone to become the member. We are various benefit. We are so many programs, IFS Genius Junction Quiz program, Patient Empowerment Program, Intelligent Empowerment Program, Young Turk Program, Counselor Empowerment Program, Nurses Empowerment Program, and after all, Self-Empowerment Program. So it's hardly 1 minute job. You can just scan the code, register in 2 minutes, and get the verification in 2 minutes. So thank you very much for the joining. We are doing this Young Tuck every second and last Friday. Young Tuck program, quiz program, mentoring session, and quiz will be once in a month. So keep on joining.
Thank you.
End it.
Thank you,
Thank you,
ma'am.
Dr. Ankita. I think all the fellows, postgraduates who are attending today are enlightened, motivated, and then we will also come up with lots of other fellowship programs. So don't worry if you're not becoming an MRCOG. We have many, many options in India. We have very, very good fellowship programs, running. So I personally feel taking the first Indian fellowship, if you want to practice in India, is must, because reading academically is very important, and then adding feathers, and adding on these fellowships is very important because it keeps you updated. And also, if you want to go out of India, then it is tremendously of help. So thank you so much. And thank you for calling me for this program. Of course, I'm always a part of all my programs.
Yeah.
Thank you, Dr. Neeru and Dr. Nisha. So we wind up now.
Yeah, thank you. Thank you,
Okay.
Dr.
See you
Shweta.
again.
Thank you,
Bye-bye.
ma'am. Good
And
night.
I want to extend my special thanks to Ankita for agreeing and guiding so well. Thank you, Ankita.
Yeah,
Thank
very
you so
well,
much.
very well.
Please feel free to contact her on the group. Thank you
Yeah,
so much. Thank you,
lovely.
Dr.
Thank
Shweta.
you, ma'am.
Thank
Good
you,
night.
sir. And thank you, Dr. Neeru, ma'am.
Thank you. Bye.
Bye. Good night, ma'am.